back, you beautiful souls. Of course, we're opening up here on S3, and it is, in fact, Health Tuesdays. You know how we do with our weekly health topic, and this one is about our skin condition that affects an estimated 30% of children and 10% of adults. Now, Dr. Dwayne Koot is joining us in the studio to teach us more about atopic dermatitis, or otherwise known as atopic eczema, and find out a little bit more about some of the signs, the symptoms, the treatment methods, and anything else going through. So, of course, Mzansi, come through in the conversation as well, because you're going to want to listen to this one. Doctor, thanks for joining us this morning. How are you doing?
I'm very well, thank you. Thanks for having me on the show.
It's always cool when you know 10% of the population is going to stand up and listen. That affects a lot of people. Even more so, I've realized as a parent with one of my children is prone to it. It can be quite a thing. It really... It can be difficult to treat in some instances, but I didn't realize how prevalent it actually is. So maybe a good place to start would be a definition of atopic eczema. What is atopic eczema specifically, and is there a spectrum? Does it exist within a broader kind of group?
For sure. Atopic dermatitis or atopic eczema, it's the most common form of eczema. It's characterized by a barrier defect in the skin and by immune dysregulation. And you're 100% correct that there is a range of severities, so it's clinically heterogeneous. 70% of patients would experience a mild form, and 20% to 30% would be more moderate to severe.
And it can be severe. It can be hectic.
Particularly the itch. The itch can be quite debilitating in the moderate to severe forms.
Now, you mentioned briefly just in terms of who is susceptible to it, but how exactly does it start? Why does it happen? And is there a way to potentially prevent it?
Yes, the atopic part of atopic dermatitis signifies that there is a proclivity towards these range of type 2 inflammatory disorders. So there is certainly a genetic component, and along with that there are environmental triggers which could exacerbate a flare.
All right, so you potentially can be more prone to having it, and the environment can potentially be a catalyst to make it a little bit worse.
Exactly that.
Okay, I'm learning.
But ultimately, blame your parents. Blame your parents. If you're scratching right now, there is someone that you can brave. Now, we joke about it, but I do know that it does affect people. So maybe you can just expand on the different varieties, if you will, within that broader scope of eczemas.
Within the eczema scope there, as you say, there are a range of different things which manifest as a rash, with atopic dermatitis being the most prevalent. But you get various reasons for rash developing: seborrheic dermatitis, contact dermatitis. That would be also an allergic component, but only where there is contact or direct contact with an allergic factor.
Okay, so if I was to maybe, I don't know if this is true or not, but I would imagine being able to identify it earlier on can potentially help with dealing with it.
Especially with kids.
How would you then tell of like potential signs or symptoms of eczema developing before it really blows up and gets a bit out of control? I don't know if that's correct.
That's very common in children. 90% of cases are going to develop before the age of 5 years. Fortunately, most of these kids do outgrow it by the time they hit puberty, but it's not often discussed in certain individuals that might come back later on in life.
Whether it's affected you as a child or as an adult, it can really, really bother you. I'm going to ask you to think about some of the solutions, because I think most of the people listening right now are desperate for a solution. Dr. Dwayne Koot is going to stick around. We are talking about atopic dermatitis, otherwise known as atopic eczema, something that affects 10% of adults and up to 30+% of children in South Africa. So a lot of people affected. Hopefully, we'll have an answer or two for you.
It's my feel-good breakfast show.
Welcome back. You are live on a Tuesday, which means we focus in this final hour of the show on health matters. And we're taking a bit of a turn, maybe in honor of going to level 2 lockdown, away from COVID and focusing on something that affects a huge amount of people out there. In fact, 10% of the population is probably really listening right now. We are back with our health specialist, Dr. Dwayne Koot, who is here to chat about atopic eczema or dermatitis and find out a little bit more about what can aggravate or activate this skin condition. We've heard that there is a partial genetic component to it. But if you have any questions for the good doctor, please head over to the Expresso Facebook page and we'll try and get into some of those a little bit later. But right now, let's continue our discussion. Welcome to it, man.
Indeed. Thank you. I just wanted to jump in because I just had
under the skin now, please.
I just had some dip in chips at the moment, so I don't know. It's not good for the skin. It's fine. But just to kind of go a little bit deeper into this particular topic, in terms of, I would like to know if there are certain people that are more susceptible to atopic dermatitis.
It certainly does run in families.
Okay.
That is, in fact, one of the minor diagnostic criteria, that there is a family history
Yes.
of somebody with an atopic condition, such as the atopic dermatitis, asthma, or hay fever.
Yeah.
So that's generally who it's going to affect. It's going to run in families, unfortunately.
Are they the same? Because it exhibited as asthma, childhood asthma with me, but my sister had really hectic eczema in that space. Sorry, Jen, for just revealing all of your private life on air. But so you mentioned hay fever as well. Are they the same genetic kind of stem?
Yes, it's known as the atopic triad, and it often unfolds as an atopic march. So with time, a child might go from atopic dermatitis on to develop asthma, hay fever, that sort of thing. It's all connected through this type 2 inflammatory connection. So underlying all these atopic conditions is immune dysregulation that's really driven by 2 cytokines. So those are immune proteins that help with the communication between the different immune cells.
They don't sound so kind.
Yeah, no,
Unkind.
when you said cytokine, I was getting a bit
Cyto-unkind.
worried. But if you look at how to manage this, I mean, is it something that we can notice in our kids, and then do they grow out of it? Or is there a way for us to better prepare for it, get interventions in early? Is that a way to deal with this type of thing?
Absolutely. Fortunately, most kids do outgrow it.
Okay.
Therapy is really stepwise. So starting off at the base level,
Yes.
it's the gentle self-skincare, which consists of liberal and frequent use of moisturizers with a good emollient to try and repair the disrupted skin barrier.
Wow.
That skin barrier is something you talk about when you become a parent. As you would know, you've got a little girl as well. Congratulations on that on that front. But you are constantly looking to repair the skin barrier of your child. I dream about it. One thing that we haven't touched on is the role that diet plays.
Yeah.
Can it exacerbate or help?
Diet is not going to be a causative factor. Okay. However, there are certain environmental triggers. Diet could be one which could exacerbate the condition or make a flare a little bit worse.
Okay.
So sometimes you do have to keep an eye out for what those triggers could be and to try and avoid any of those environmental triggers.
And would that be specific to each person, or is there a blanket thing? Can we say, like, don't eat MSG because that triggers eczema, or is it something that's going to be very specific to each individual case?
I would definitely not apply blanket rules and start avoiding foods like that. I think you've got to consult your doctor and perhaps a dietitian to see if maybe there are foods you should start avoiding.
Something triggering it, cool.
I wanted to know, you mentioned there's got to be a certain constituent of moisturizers.
A lot.
What should we be looking for if you're going to get a moisturizer to make sure the barrier's up? I'm sure there's a couple of standards. I mean, this is very commercialized, but yes. What are some of the things we should be looking for in there to help our skin barrier?
Basically, the more expensive, the better.
Not necessarily.
Yeah, because I'm sure there's a product or something in there, an oil of some sort that you need to look for. Can you give us a little help on that?
You're looking for something that has got a good emollient in it.
Yes.
So an emollient is something which is going to smooth and soften the skin.
Okay.
So if we have a disrupted skin barrier, it's cracked.
Yes.
It's going to be leaky, so water's going to transdermally evaporate.
All right.
If you lose that moisture, the skin gets itchy. So an emollient is going to smooth that over and maintain the hydration within the skin.
In the skin.
Wow.
Something like petroleum jelly.
Yes.
That could be a good occlusive agent. So again, it just coats the skin and prevents any water loss.
Nice.
Love it, man.
Something as simple as that.
And then you shine for the rest of the day.
Day.
You shine, man. Absolutely brilliant. I'm learning so much. Thank you so much. I'm so glad that we have the expert in the house. The good doctor is not going anywhere. We're going to answer some of your questions, maybe take some of your comments. If you are affected by atopic dermatitis or eczema, please let us know on the Expresso Morning Show Facebook page. We'd love to get to some of your questions. But first, let's move.
Oh, yeah.
It's my feel-good breakfast show.
Welcome back. You are still live with Expresso as we continue to do a deep dive into health matters this morning. We are joined by a man who has proven himself to be just the expert we need, Doctor Dwayne Koot, learning more about a skin condition that affects an estimated 30% of children and 10% of adults. So hopefully a lot of you are receiving some kind of empathy and help through this process. We've asked you to send in any of your questions that you might have for the good doctor before we round things up this morning, and I think a couple have come through.
Indeed, a few questions have come through. Just to reiterate, just in case anybody didn't watch our couple of parts, just in terms of the genetics behind it, can you pass it on to your kids? I think let's answer that question just to kind of set the scene, Doctor. Is that indeed possible?
Absolutely.
Okay, so as long as we got that clear, we just want to recap that.
It's your folks' fault. We established this earlier. It is, you blame your parents if you've got it.
And let's go to the question. Now, Simtambile said this. What's the helpful indigenous way that Dr. Dwayne Koot recommends to you when dealing with inflammation and blisters on the skin if you don't have any means to buy products for dermatitis? So basically any remedies at home that could assist.
I think the gentle skincare regimes in terms of bathing would apply in this instance.
Okay.
So you don't want to bath with water that's too hot, lukewarm water, and also not for too long.
Okay.
And as soon as you get out the bath, gently pat dry your skin and then try to apply some moisturizers if you have got some, or some Vaseline.
Okay.
And like petroleum jelly, we've heard that's enough at this stage. And I would also maybe then add to that, avoid harsh soaps on the skin, the pH balance?
Absolutely, absolutely. You need to avoid anything which can irritate the skin, such as soap. So a good soap substitute would be an aqueous cream or something similar to that.
That's what I use on my baby, actually, yeah.
Wow, that is absolutely incredible. So in terms of the comments that have come through, is another one, Nadia's saying, I have a dermographism. Is there anything I can do to lessen the effects?
What is that? What is a dermographism?
Dermographism.
Yeah.
I must say, I'm not too sure what that is.
Come on, what kind of expert are you? You don't even know what a dermographic is. Okay, we don't.
Did you say demographic? Well, okay, let's move on to the next one, just so that we can move. We've got Jane saying, please, just the do's and don'ts for my daughter suffers from eczema, and it's frustrating to both of us, so please help. So anything that you can give them, some of the do's and the don'ts. I know we covered a lot of the do's, but let's just reiterate.
Moisturize frequently and liberally.
Moisturize.
If that's not getting the job done, it's time to see your general practitioner. It might then be time to step up the therapy, and doctor might then prescribe a topical corticosteroid cream to reduce those flares.
Because it can become incredibly inflamed and often exacerbated by, like, if it's hot weather, and we spoke about that exhibiting in the creases where the sweat kind of gathers.
Yeah.
More comments coming through.
Indeed, there are. Another one is around food. It's a food question here, saying, does food, for example, citrus fruits, affect eczema? Any ideas?
It could increase the severity of a flare, but I'm definitely not going to be one who's going to suggest removing food out your diet without first consulting a GP or a dietitian. In most cases, it's not going to be the food that's causing it, but rather just the skin condition that's drying out, needing more moisture.
We had a question come through earlier. It seems a bit silly to ask this now, but a lot of people will be thinking this.
Yeah.
Is it contagious? Can you catch eczema from someone else?
No, you certainly cannot. There's no infectious pathogen behind this. It's just your genes interacting with your environment, and something's causing an irritation, sparking up the type 2 inflammatory response.
And I'm so happy that you mentioned that, because there's a big stigma around those with eczema, and unfortunately it's like, oh my word, you have something. But at least you know it's not contagious. It's a skin ailment, and it's something that somebody would be treating, so there shouldn't be a stigma around it.
It is so unbelievably common. You've been amazing. You really were the exact person we needed this morning. Thank you so much. You've opened our eyes. I've learned a huge amount, and certainly as a parent, and one of my children is affected by eczema, it really does help to know that there are ways that you can treat eczema quite simply. You don't have to break the bank. Just look after your skin, stay hydrated, keep that skin barrier intact.